Hey guys, this is Dr. Today we are looking at the human porphyrias and its features. So we begin with the AIP. So the AIP, it stands for the acute intermittent porphyria. So it is acute intermittent porphyria. So under this, what are the presenting symptoms? The presenting symptoms, it is neurologic. So it is neurologic. So how about the onset? The onset is it is an adult onset. So what are the exacerbating factors? Exacerbating factors, it includes the drugs. So drugs such as the P450 inducers. Next, there is also the presence of the progesterone, and there is also the dietary restrictions. Now, what are the most important screening tests? So the most important screening test. So the most important screening test, it includes the urinary porphobilinogen. So it is nothing but the urinary porphobilinogen. So how to treat this acute intermittent porphyria? The treatment is by the hemin or the glucose. Hemin or the presence of the glucose. Next we look at the porphyria cutanea tarda. So in short, it is known as the PCT. That is the porphyria cutanea tarda. So what is the presenting symptoms here? The presenting symptoms is that there is a chronic skin blistering and fragility. There is a chronic skin blistering as well as the fragility. Next is the question on the onset. Upon the onset, it is nothing but the adult onset. And what about the exacerbating factors? This includes the presence of the iron, alcohol, the smoking, as well as the estrogens and the Hep C, hepatitis C. Then comes the HIV and the halogenated hydrocarbons. Halogenated hydrocarbons. Now let's look at the most important screening test. The most important screening test, it includes the plasma. It includes the plasma or the urine porphyrins. Then comes the treatment part. The treatment will be the phlebotomy and the low dose hydrochloroquine. Low dose hydroxychloroquine. Next, let's look at the erythropoietic protoporphyria. So, erythropoietic protoporphyria. So how does this present with? It presents with the acute skin swelling and pain. So there's acute skin swelling as well as there is presence of the pain. So how is the onset? Onset it is a childhood onset. So what are the important screening tests here? The screening test here is erythrocyte porphyrins. So it is the erythrocyte or plasma. Erythrocyte or the plasma porphyrins. Next is the question on the treatment. The treatment is the beta carotene. Beta carotene is the